We're wrapping up our discussion on the state of Canadian healthcare and how that affects you and maybe what can be done to better it. And join me again is Colin Craig and Dr. Shawn Whatley. Before the break, Dr. Whatley, we were having a very good discussion about not just the state of Canadian healthcare, but how things are managed, if you will. Please continue where you were left off.
Yeah, so I think to fix what we have to start back at the beginning and ask, why do we have Medicare? What do the citizens of Canada actually want? I think most people want care when they need it. That's what they look at Medicare as offering. However, other elites in society, and I mentioned Roy Robineau, he's been very public on this. He refers to Medicare as our great redistributive program, and so it's a way to transfer money from the wealthy and the healthy to the sick and the poor. And so if that is our objective we're trying to achieve, that will deliver very different performance. And so we need to have these fundamental debates and actually bring Canadians into the debate. Furthermore, Canada is different. Canada in 1960 is very different than Canada today. We're older, we're much more diverse. So we need to start from first principles. What are we trying to achieve? Who are we trying to help? And what are the constitutional constraints within which we're trying to help them? So I would suggest that's where we need to start. And then we can talk about policy options.
Now, Colin, again, your organization is very good at highlighting the numbers, which I appreciate, and it leads the reader to say, well, where do we go from here? How do we fix it? Is private healthcare, what does even private healthcare look like? Is that as an option? Would that solve things, in your opinion?
Yes, and I think we have to be very careful when we talk about private healthcare, because what most people who talk about reform are meaning is that we keep the public healthcare system. So just as people can go to their doctor right now or get their hip done or whatever, and they don't receive a huge bill directly for it, that would continue. But you would allow patients the choice that if you didn't want to wait a year to get your hip done, you could go to a private clinic in Canada in your own city and pay for it and get that done. That would actually help. It would help increase the number of people working in the system. You'd have more competition. It could lead to innovation. There's all kinds of benefits. Most importantly, countries that outperform Canada, they give patients that choice. Those universal healthcare systems that do better in countries like Sweden and Australia and New Zealand, they give patients that choice between the public and private options. So
because
that's definitely part
let's
of the
face it, Colin, patients still do have the choice. They go to America, they go to Mexico, or they'll go to India. They'll pursue what they want to pursue if they need something done. It's just that money's not staying in Canada. It's going to a private clinic in the US. So would it not just make sense to just have that option locally so people didn't have to travel so much? And I mean, again, I don't like to view healthcare as a business, but at the end of the day, there's a need or there's a demand. Let's fill it.
Yeah, exactly. I talked to a patient recently. He was in Edmonton and he needed back surgery. It was going to take a long time in Alberta to get the surgery done in the public system. And he looked across Canada because there are some private clinics. There's one in Calgary, but he couldn't go there because he's an Alberta resident. So he even considered moving to British Columbia so that he could then come back to his home province to go to Calgary to do it. In the end, that didn't work. And what he ended up doing was going to Atlanta. So it makes no sense from an environmental perspective to make patients have to increase their carbon footprint just to get healthcare. It doesn't make sense for patients to force them to wait in pain for so long and give them no options. It doesn't make sense for the economy when that happens, because patients end up taking thousands of dollars out of our economy and spending it somewhere else, supporting organizations that hire and employ people in other countries. So it doesn't make sense on many different fronts.
Now, we only have a minute before left of the show, and maybe Dr. Whatley or Colin, I don't know who wants to take this, but Quebec has an interesting model. Is it unique? Because, I have been informed that they have some kind of two-tier system. Is that correct, Dr. Whatley?
Yeah, so they're slowly offering more and more procedures within a non-government system. And to build on that, people get scared, you're going to steal doctors and nurses. Well, actually in Ontario, for example, we have IVF procedures available privately. If we only offered them publicly, we could only afford to have about 5 or 6 clinics in Ontario. We actually have close to 13 clinics, somewhere between 12 and 13 clinics spread across the north, the southwest, all over the place, because we offer a blended approach. So care closer to home, more people being hired, a building of the industry because we offer that blend. And I think that's what Colin's calling for.
Okay, well, this has been a very good discussion, and I know we're going to have to touch upon it in the near future again. But thank you both for joining me.
Thanks a lot.
Well, we've highlighted a lot of concern here within the Canadian healthcare system. And of course, the point of bringing you these facts and figures and the accounts, firsthand accounts, is to tell you that there's a concern here and we need to make it better. And hopefully some of these discussion points will, in fact, trickle down and make the system better. For Counterpoint, I'm Tanya Granick-Allen.